Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. April is Move More Month, and UnitedHealthcare is asking Americans to walk more and commit themselves to better health. If you need a little incentive to get up and go, UnitedHealthcare's Nelson Raines will be here to tell us about the second annual Step Up for Better Health sweepstakes. Just by walking a little bit every day, you can win a walking-related prize and help raise $25,000 to reduce childhood obesity, including contributions to Boys and Girls Clubs across the country. If you're interested in public health issues, activism, and health equity, you won't want to miss the first annual Public Health Film Festival of New Orleans. The FNO Film Fest will showcase cinematic stories that emphasize disparities in both public health and basic individual rights. FNO takes place in May, and Executive Director of 102.3 FM WHIV, Dr. MarkAlain Dery, will join us on the couch for a preview. In our Community Health Heroes report, The Faces of VA. It's a portrait exhibit at the Veterans Medical Center on Canal Street, and it profiles the faces and stories of our local veterans. I'll take you to that exhibit and tell you more about the mental health challenges many veterans face every day. And Robert Fresh Market is now an Eat Fit grocery store. In the kitchen, Marc Robert will tell us how customers can make healthy choices while they're making groceries, as he prepares Robert Fresh Market chicken salad and cedar plank smoked salmon. So don't go away. We'll be right back with more Community Health Heroes.
Does your family need a break from the daily routine?
Hello, I'm Dr. Spruce. If you or someone you know needs a healthy dose of nature, visit discovertheforest.org and trade in the big screen for the big blue sky by visiting a local park or forest near you.
Hiking, picnicking, swimming, orienteering, climbing, admiring wildlife, or inhaling fresh air may result in heightened creativity, feelings of joy, harmony, satisfaction, and a euphoria that can only be explained as oneness with the natural world. Whoa.
Welcome back to Community Health Heroes. Did you know that according to UnitedHealthcare, walking can help reduce the risk of high cholesterol, high blood pressure, heart disease, and diabetes? It can also help improve your overall heart and lung health, increase your muscle strength and endurance, boost your mood, and promote creative thinking. With us now is Vice President of Sales of UnitedHealthcare, Nelson Raines, to tell us more about Move More Month and how you can earn some great prizes just by getting up and taking a walk. Thank you, Nelson, for joining us today.
Absolutely. Thanks for having me.
Well, UnitedHealthcare is celebrating the second annual Step Up for Better Health sweepstakes. Can you tell us a little about the sweepstakes and why it's important to start walking?
Yeah, absolutely. Well, the sweepstakes is online, www.uhcwalkingmaps.com. Get on there. Get on the site, register. It's really easy, quick to do. A lot of great prizes that are available. We're going to have a grand prize, send 2 people to the Grand Canyon, take advantage of all that has to offer, walking, hiking out there. Second prize, we're going to be giving away 10 Apple Watches. So 10 lucky participants are going to have the opportunity to win an Apple Watch. And then the third prize we're giving away is going to be 100 gift cards for $25 to a Foot Locker. So you can apply that $25 to your next pair of walking shoes, running shoes, or any type of apparel that you'd like to buy.
So for people who think walking is a chore, you actually just made it a lot more fun, thinking you can get one of these really great prizes.
Absolutely,
I'd like to get one of those Apple Watches. Tell us about why it's important to be one of the first 25,000 to sign up. There's a little bonus, right?
Yeah, there is. So in addition to the opportunity to win the prizes, United's also committed to donate $25,000 to various Boys and Girls Clubs throughout the U.S. So as first 25,000 people that sign up, they're going to donate $1 for every one of those 25,000. So a little extra incentive to get people signed up.
Now I know in New Orleans, they're walking routes all over the nation. UnitedHealthcare has designated quite a few all around. But I know in New Orleans there's a special one in the Lower Garden District. Can you tell us about it? Like how long is the walking path?
Yeah, absolutely. So the one in the Lower Garden District, if you're familiar with the area, it's a very walkable part of town. There's not a lot of hills to New Orleans, right? So, but it's a little over 3.5 miles and a little over 7,300 steps. It's a beautiful walking path to take, and we encourage folks to take advantage of that.
There's also some, I remember looking on the graphic, and there's some historical spots too, so you learn a little history about New Orleans.
Yeah, absolutely, taking some architecture as well, so yeah, it's a beautiful walk.
Now I know the American Heart Association actually started the Move More Month, and you guys are kind of collaborating with them, trying to get people to walk more. But can we talk a little about the benefits of walking? Because I mean, we kind of take it for granted. I mean, we walk every day, but when you walk for fun or for exercise, you really help your system so much. Could you tell us a little about what people can look forward to when they go out and walk?
Yeah, certainly. So in addition to walking being fun, you also improve your overall health and well-being, right? So whether you're trying to maintain your weight or you're looking to control or prevent some type of chronic disease, diabetes, hypertension, any type of cardiovascular disease. It's just great for your overall health and well-being, and in addition, it's a great social environment too as well, right? So whether you're walking with family or friends or in a walking club, you have the ability to develop and grow relationships there. So.
Now, I guess the big question is, how much should you walk a day? Because I mean, you want to get the exercise, but you also don't want to overdo. And people may not have 2 hours or something to go out walking. So, what do you recommend? What does UnitedHealthcare recommend?
Yeah, so it's a really easy slogan that we use, right? We call it Think Fit. FIT stands for frequency, intensity, tenacity. So the frequency piece is going to be 500 steps 6 times a day within 7 minutes. You want to make sure those are an hour apart. The second is going to be intensity, so you're looking to get 3,000 steps within 30 minutes. And then the last T for tenacity is going to be a total of 10,000 steps in a day. So combine all those 3 in a day and you'll be well on your way to your goals.
Now I know some people who wear those little devices, those mobile devices on their wrist that track their walking.
Yep.
When it hits 10,000, sometimes you see like little fireworks or something. I know UnitedHealthcare has a special device that you can wear, right? Could you tell us about that? Yeah,
we actually have a program that we offer to clients. It's called Motion. Motion allows you to earn dollars or deductible credits to your benefit plan. It's not just United though, several other carriers out there also offer that. With several different vendors that have the ability to track and monitor your steps, and then you can receive rewards for doing that. So, as we mentioned at the beginning, we're giving away 10 Apple Watches, so that would be a great opportunity for folks to sign up for that, take advantage of those.
And one more time, how can people sign up?
Yep, www.uhcwalkingmaps.com. There's an online registration form. Hop on there, sign up, you'll be ready to go.
Great, Nelson. Thank you so much for stopping by today and telling us all this. I'm actually enthusiastic about this. I want to go start walking right now.
All right, let's go.
Thank you. When we return, a preview of the FNO Film Festival. We'll be right back.
This is what high blood pressure looks like. Talk with your doctor to create a treatment plan that works for you. Go to loweryourhbp.org.
Did you know, according to America's Health Rankings, Louisiana ranked #1 as a state with the greatest health challenges and #3 in health outcomes last year? Louisiana has the highest prevalence of child poverty in the country, in addition to some of the highest rates of low birth weight, smoking, and obesity. Tulane University School of Public Health and Tropical Medicine, the Southern Center for Health Equity, and 102.3 FM WHIV are producing the first annual Public Health Film Festival of New Orleans in May. Through film, the FNO Film Fest aims to inform and educate the public about health disparities and create change. With us now is Executive Director of 102.3 FM WHIV, Dr. MarkAlain Dery, to tell us more about the festival. So glad to have you here, Dr. Dery. Thank you for joining us today.
Thank you so much for having me.
First, I want to talk about your radio station. Can you tell us about it and what you do there?
Sure. So I was fortunate enough to actually start a radio station here in New Orleans, and we called it WHIV. I'm a HIV doctor here in New Orleans. And so while the radio station is not necessarily about HIV, I really use the letters H and I and V as a surrogate or an acronym for human rights and social justice. If I could have called it W, Human Rights and Social Justice Radio, I would have. I couldn't. So I really used HIV as 3 letters to really focus on progressive programming that we have on the radio station. We focus on all things human rights and social justice and progressive programming.
So why did your radio station want to get involved in this wonderful new film festival?
So the Public Health Film Festival of New Orleans is a brand new entity that we're starting up. It turns out that there are no public health film festivals around the country.
Which is hard to believe.
Which is hard to believe. And there's so many great documentaries and there's so many great movies. And so the power of a movie and the power of a documentary is so much more than a statistic could ever be. So using the power of storytelling and the power of movies and documentaries, we really can get across messaging that really pushes us toward public health.
Now, before we talk about some of the movies, just give us the nitty-gritty. When's the festival going to take place and where are the screenings going to be held?
So the festival is going to be taking place May 10th through May 12th, and they're going to take place at the School of Public Health at Tulane on Canal Street. And
I know there are quite a few movies that run the gamut of a lot of important topics. Tell us about some of the movies we should look out for.
So some of the movies I'm particularly interested in is on Friday night, our opening night, we have a movie called Bending the Arc, and that is a movie about Paul Farmer. Paul Farmer is also an infectious diseases doctor like I am, and he specializes and does a lot of work in Haiti and does a lot of work with HIV and TB. And it's kind of a movie that's kind of following his life story and the amazing work that he's done with partners in health with respect to really helping the Haitian communities.
I know there's a movie that focuses on Ebola. Can you tell us about that one?
Right. So during the 2014-2015 Ebola outbreak, it had come to my attention that a Nigerian physician, her name is Dr. Adora Akuli, who now lives here in New Orleans, is actually going to be starting her residency in internal medicine at Tulane. She was actually just recently named the Bill Gates Healthcare Hero. She was actually single-handedly responsible by making sure that the Ebola outbreak was contained within her hospital and never moved out into the community. The movie that we're actually showing is a movie that's never been screened in the US. It's called 93 Days. It's a movie about her, and it's a movie about her life and what she has done. And it's starring very, very famous Nigerian actors. I think the equivalent of the Angelina Jolie of Nigeria is playing Dr. Akuli. Dr. Akuli's never seen the movie, so we're very excited. She'll be at the screening.
Well,
and so it's very exciting. Yeah.
I know another interesting film is called Katie and the Black Robin Hood. Could you tell us a little about that one too?
Yeah, so this is a great movie by John Ritchie, local filmmaker, and what he's doing is he turned his camera onto the New Orleans Public Defender's Office, and this incredibly innovative project that they've been doing is that they've actually are starting to film their clients, and they're showing their clients' origin or life story at the sentencing phase of a case. And so this is a really incredibly innovative project that the New Orleans Public Defender's Office is doing, and John Ritchie turned his lens onto them. It's really an amazing movie.
Now, it sounds like this could have been a little lagniappe that so many of these films had Louisiana, New Orleans ties. Was that something you were looking for? It just so happened that it turned out that a lot of these documentaries had these natural ties to the state.
Yeah, that's a great question. For us to find this first annual film festival and looking at films, it was easy for us to kind of collect these films because there's so much there available for us to choose from. And what we're really hoping to do with this film festival and the annual film festivals that will come after that is really focusing on the importance of public health and the importance of environmental health as well, so that people can really understand these topics in a way that they feels personal to them. One of the things that we're also going going to be doing as well is these moderated panels.
I know you're very excited about that, because it sounds like after the screening, it just doesn't end there. You're going to actually be talking to people who are actually in the film, who created the film.
Every film block will also have experts in the field or individuals that were featured in the documentary to talk about and help unpack the intensity of the movie, so that it will help kind of give context to the pictures. It also will allow people that are in the audience to be challenged to take up that cause and move it to the next step.
So I guess one of the most important questions is, how can our viewers find out more about this festival? What's the website?
So f-no.org. The name of the film festival is the Public Health Film Festival of New Orleans, and so we call it FNO because it's an acronym of an acronym. You take the PH, the FF, and they're all F sounding. So we just called it FNO. So it's f-no.org. All the movies are free. They're open to the public. But the seating is limited, so you really do need to register way in advance, right? Yeah, we do ask that everybody goes to the website. They're able to register. All the screenings are free. Everything. We really wanted to make this open to the community. The Dean of the School of Public Health is very open to opening up that building so that people can go in. It's a beautiful theater that we're going to be screening these movies in.
Well, congratulations. I hope the first film festival goes well, and hopefully we'll be back talking about the second one.
I hope so.
Thank you, Dr. Dery. Great meeting you.
Thank you.
We'll be right back.
Our veterans put everything on the line to protect our freedom. We may never be able to repay them for their sacrifice, but we can show them just how much we appreciate all they've done. Every day, hundreds of people just like you volunteer to help our veterans. You can help by simply sharing your time, lending a warm smile, a supportive hand, or a sympathetic ear to someone who needs it. Everyone can do something to make our veterans know how much we appreciate their service. What will you do?
Did you know, according to the Department of Veterans Affairs, about 20 veterans die by suicide every day? Post-traumatic stress disorder, or PTSD, affects about 1 in 10 Afghanistan veterans, and as many as 1 in 5 Iraq war veterans. Although many veterans reintegrate back into civilian life without any problems, many don't, and barriers to access can make getting the care they need more difficult than it has to be. You know what they say, a picture is worth 1,000 words. At the New Orleans Veterans Medical Center at 2400 Canal Street, there's a special photo exhibit called Faces of VA that features veterans who are patients of the VA healthcare system. We'll share some of those photos and the stories behind them in our Community Health Heroes Report. U.S. Army veteran Stephen Lasserre was a part of the 4th Infantry Division and one of the first combat troops sent to Vietnam in 1966. He got wounded and received a Purple Heart and a Bronze Star. Stephen and his wife Priscilla live in Lafourche Parish and have both been volunteering at the Southeast Louisiana Veterans Healthcare System for more than 22 years. Lasserre is being honored again for his service in a photo exhibit called Faces of VA, where he gets to share his story about his mental health rehab.
The mental health struggle that I faced, it was real bad. My brain wasn't working right. And I used to have suicidal thoughts and everything, and I couldn't keep a job. I couldn't talk to anybody. You know, I had to be alone, and it was very hard on me.
Mr. Lasserre represents the lion's share of our patients, in that most of our patients are Vietnam-era patients. When those men and women returned home, many of them came with post-traumatic stress disorder. In those days, we didn't even really understand, in healthcare, in medicine, we really didn't even understand what those symptoms represented. We've come a long way. The VA has led the way in best treatments for post-traumatic stress disorder.
Medical Center Director Rivera said the Southeast Louisiana Veterans Healthcare System provides primary, specialty, and mental health care to veteran patients like these throughout 23 parishes in Southeast Louisiana. He said the whole VA system takes care of 10 million veterans, and a third of weekly visits are by veterans seeking mental health services. Faces of VA is currently on display through Friday, May 28th in the public areas of the Veterans Medical Center at 2400 Canal Street in New Orleans. It features veterans who are patients of the VA healthcare system sharing their stories. Lasser said he saw treatment decades after his service in Vietnam, and he credits the VA's psychiatric and group therapies for bringing him back to life.
Well, I'm hoping to get the message that this facility here and the people here is ready and able to help them out with any need they got. That's the number one thing I realized when they're reading those pictures and everything. They see what we went through, and they know that they can get the help over here that they need.
It's wonderful to see our patients, our veterans, our nation's heroes, explaining to us what our services mean to them on a personal level, for their health care, for their overall quality of life, and for their willingness to live a fulfilling life. These pictures that you see represent, in many ways, evidence of that experience. Mr. Lasser has been, is a really clear example of someone who has stayed with the VA and has continued to thrive and has continued to enjoy life and be successful in life, but all throughout, always connected to his VA healthcare system, his doctors, his nurses, his medical center here in New Orleans.
You see, I'm laughing, happiness. Before that, I wouldn't smile or nothing, but now I can smile back. They brought me back.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
I'm Molly Kimball, registered dietitian and founder of Oxner's Eat Fit NOLA. We've collaborated with more than 100 partners locally to create Eat Fit NOLA, a partnership that highlights the better for you items right there on a restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit NOLA, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away, Community Health Heroes will be right back.
With 5 locations in and around New Orleans and 1 in Baton Rouge, Robert Fresh Market is where a lot of us go to shop for groceries and pre-prepared meals. And now, Robert Fresh Market has officially become an Oxner Eat Fit store, which means they take the guesswork out of healthy eating and shopping. Marc Robert with Robert Fresh Market and Eat Fit NOLA registered dietitian Lauren Hewlin are both here to show us how to prepare Robert Fresh Market's chicken salad and cedar plank smoked salmon. So great to have you here. Congratulations. It's a big deal, right?
Thank you for having me.
What does that do to Robert's? I mean, is the shopping experience change a little because you're now Eat Fit approved?
I think it definitely embraces our brand. We're a brand that always pushed to have healthier offerings and educate our customers on how to shop healthy, eat healthy, and live healthy lifestyles. And this definitely embraces our brand and helps the customer experience.
And in terms of the Eat Fit criteria, Lauren, could you just remind us what that means, what you can find on the store shelves now?
As you're going up and down the aisles, you can see which items are going to be your better for you options. We even have a little shopping guide that you can pick up at the front and brand specific, so truly taking the guesswork out of it.
And I do, for Eat Fit or approved items, that means less than 1 teaspoon of sugar?
Yes. Less than a teaspoon of added sugar is going to be approved, so that's about 5 grams. And then we also look at your lean protein. So we monitor saturated fat coming from animal protein, and then we also monitor the sodium going into that dish or that product.
Now, talking about lean protein, I think I'm looking at a bunch of it right here. Marc, tell us about all the food you brought today and what you're going to be preparing for us.
So this is our chicken salad that we make fresh daily. One of the greatest things about this is this was actually from my Italian grandmother's recipe.
That's so nice.
And simplicity is definitely a big component of it. So the basic components are chopped onions, chopped celery. We have a little bit of mayonnaise, not too much.
That doesn't look like
a little bit of honey. This is actually our secret ingredient that kind of gives it a little kick. And then we have white pepper and granulated garlic, and just a little bit of each. So what I have here right now is 6 whole chicken breast that we have steamed. And then this was a half a tablespoon of white pepper and a half a tablespoon of granulated garlic. And then we have a half of a cup of chopped celery. And then we have a half of a cup that goes in this recipe, and I'm not measuring it out for the purpose of today's show, but we do at our store would measure that out.
That looks pretty accurate.
That looks pretty accurate. And then
looks like you've done this once or twice before.
Right, and then this would be a half of a cup of mayonnaise, and then we would have a third of a cup of honey.
Oh my goodness, and that's the secret ingredient.
Put a little bit of honey. Yeah, that is kind of our secret thing that people do not expect.
Honey's a really good natural sugar?
So honey is still considered an added sugar, as is, your white granular sugar, but it's the amount that's going in there that we monitor, and it's not going to be more than 5 grams of added sugar. And one thing about this recipe, it was Eat Fit as is. So from day one, they were doing an Eat Fit approved recipe and they didn't even know it.
No added salt, yeah. And the other thing I forgot to mention too is that we actually hand pull that chicken breast when it comes out the steamer instead of chopping it. And that gives the consistency that you see above in front right there. That's the finished product. And so we serve this in 2 ways. We serve it in 16-ounce containers. These are 16-ounce containers, and so it'll be pre-packed, pre-weighed with a label on it. But we also have it on our salad bar, and that's how most customers shop it. So people will come and they'll make a salad, they'll put it on top, or they'll come in and they'll grab 3, 4, or 5 pounds at a time, bring it home for the rest of the week.
And so before Marc chose us his magic here, tell us just a little about salmon and the great nutritious qualities it has.
So salmon's a great fatty fish. It has your DHA and EPA, which are omega-3s.
And people love the way it tastes.
Yeah, and it's delicious, so you can't go wrong there.
And how do you prepare your salmon at Robert?
So we start with a fresh piece of 8-ounce salmon, and then what we do is we take the skin off, and we soak these cedar planks first for about an hour. And the key to preparing quality salmon is salmon has a bloodline in it, all salmon. And really all fish. So this is a great tip when you are cooking fish. And the bloodline is what tastes fishy. And then it's really not rocket science. We have a couple different seasonings that we use. This is one of our famous ones, the favorite ones. This is Paul Prudhomme Magic Seasoning. And so we didn't reinvent the wheel. We took it from a great New Orleans cook, and we season like that. And then we preheat the smoker to 250 degrees, and we put it in there, and it stays in there for about 30 minutes. You don't want to over smoke fish.
No, you don't.
And you lose the moisture if you do. So by not over smoking, it really makes it delicious. And then we let it cool, we wrap it, and that's our finished product for sale.
In terms of going back to the salmon, I do know you're selling a lot of seafood now because Robert's is considered a Lenten destination. Can you tell us about all the fresh seafood you can find at Robert's?
So lots of options, a big focus on seafood. And we definitely try to be a Lenten destination, and plenty of wine and beer to go with that, like a true Catholic.
So how can our viewers find out more about Robert's?
On our website, www.robertfreshmarket.com, we have all the information. We also launched an online shopping platform, and we do both delivery and curbside pickup, and that's become something that's really gained a lot of traction.
I can imagine that's going to be very popular. So. And Lauren, tell us more about Eat Fit. How can people find out more about that?
Yeah, so absolutely. You can download our free Eat Fit app. It has Robert's, the shopping guides on there, recipes, all of our restaurant partners, and then also online, eatfitnola.com, to find out more information.
Oh, great. Well, thank you both very much. This was beautiful, and it's great to know you can buy it pre-prepared, but it's also nice to know you can make it yourself if you wanted to, especially with these ingredients. Looks great. And we will put your recipes up on our website at communityhealthheroes.org. So thank you both again.
Thank you.
We'll be right back.
After 15 years of smoking, Eva Marie quit. There's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. Learn more at savedbythescan.org.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurants, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we've provided you about Move More Month and UnitedHealthcare's Step Up for Better Health sweepstakes, the FNO Public Health Film Festival of New Orleans, the Faces of VA photo exhibit, and Robert Fresh Market will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Make sure to join us next time for more Community Health Heroes.